Posterolateral corner injuries. Lateral knee structures. Layers repeated again. Type 1, layer 1, iliotibial tract and bicep. Layer 2, patellar femoral ligament. Layer 3, superficial lateral collateral ligament and fibulofibular ligament. Layer 3, deep arcuate ligament, corner ligament, popliteal tendon, popliteofibular ligament, and capsule. Between 1 and 2, common peroneal nerve lies. Between superficial and deep, lateral geniculate artery runs. The most common injury mechanism of PLC involves posterolateral directed force to the anteromedial aspect of tibia or knee hyperextension or severe external rotation of the tibia while knee is partially flexed. In acute presentation, lateral side knee pain, ecchymosis, swelling, perceived side-to-side instability, and posterolateral rotatory instability. In chronic cases, instability with side-to-side activities, varus thrust gait, difficulty maintaining full extension, limited ability to resume sports. Examination: look at contusions at the posterolateral corner, varus alignment, and gait with varus or hyperextension thrust gait. Clinical examination: varus thrust gait that's at 0 degree indicate lateral collateral ligament with cruciate, and at 3rd degree flexion it indicates isolated lateral collateral ligament injury. You should do a tile test in 3rd degree and 9th degree. 3rd degree is for posterolateral corner, 9th degree is for PCL. In both, if in both there is external rotation, then it is PCL and PLC both. More than 10 degree of external rotation compared with the opposite side. External rotation recurvatum test in setting of posterolateral corner and ACL injury. The toes are suspended supine. Leg falls into external rotation and recurvatum. Posterolateral drawer test. The position of the knee is 80 degrees flexed and foot is in external rotation, and posterior drawer test is done. If there is laxity, this means posterolateral corner is disrupted. Reverse pivot shift test performed with knee flexed to 89 degree, valgus stressed, external rotated force applied, knee is then extended. The posterolateral sublux fibula reduces when iliotibial band goes anteriorly and visibility reduction happens. Common peroneal nerve injury should be assessed. Commonly happens at 15-29%. Hoxton classification of PLC injuries. Grade 1, 0 to 5 mm or 0 to 5 degree of opening. Minimal ligamentum tear or no abnormal motion or sprain. Grade 2, 6 to 10 degree open, partial tear or slight moderate abnormal motion. Grade 3, more than 10 millimeter or more than 10 degree of opening, complete tear with marked abnormal movements. Fennelly classification. Type A, 10 degree increase in external rotation of the tibia. Structure involved: popliteofibular ligament and popliteal tendon. Type B, 10 degree increase in external rotation of the tibia. Slight varus relaxation, 5 to 10 mm. Structure involved: popliteofibular ligament, popliteal tendon, and lateral collateral ligament. Type C, 10 degree increase in external rotation, severe varus relaxation. Structure involved: popliteofibular ligament, popliteal tendon, fibulocollateral ligament, capsular avulsion, and cruciate ligaments. Avulsion, fracture of the fibula, called arcuate fracture. Treatment: non-operative knee immobilizer in extension for 4 weeks, to be followed by progressive strengthening and mobilization. Indication isolated to grade 1 and grade 2 PLC injuries. Operative. For the PLC injuries, avulse from the fibular head, lateral collateral ligament, popliteofibular ligament, and bicep femoris or popliteal tendon from the underlying bone, anatomically reduced to their attachment site, best to be done within 2 to 3 weeks. Acute repair, use suture anchors or direct repair, arthroscopy for diagnosis and treat intra-articular injuries, posterolateral columnar reconstruction. Goal is to reconstruct LCL and popliteofibular ligament. The procedure is called Laprade anatomical reconstruction. It involves two soft tissue grafts. First graft reconstruct LCL and PFL. Second graft reconstruct the popliteal tendon. Various high table osteotomy added in chronic cases.